Hello, everyone. I'll just give a minute for others to join on here. So we'll get started in just a little bit, but I'm really excited for us to be having this time together, and I'll introduce myself in just a minute, but I have to be honest that I don't personally have Facebook myself, and so a lot of this is new to me, and so we can learn together. But I'll just give it a couple more seconds just for others to join on here. All right, so if you guys have any questions, feel free to put them in the chat. I'll try to answer as many as I can. If we run out of time, feel free to engage with any of our social media pages with Hearts for Hearing, or on Instagram, obviously Facebook, Twitter, LinkedIn, and YouTube. And we also have a wonderful website, and feel free to check that out as well. So, I'm just going to take the time to introduce myself. My name is Esther Kim. I'm an audiologist here at Hearts for Hearing. I'm also the adult clinic director as well, and I'm really excited to engage with you all. I consider this more of a conversation more than anything. So like I said, please feel free to add questions in the chat if you'd like. But just to start off, I figured, this past year has been a little bit crazy with the COVID-19 pandemic. I think we've all lived much quieter lives than we normally do. I know for me it was a huge adjustment, just not being as social and not being as out there in the community. And now that people are getting more vaccinated, I think people are feeling more liberty and freedom to be more social and just be around loved ones. And I know for me, I'm just trying to get back into living a healthy lifestyle and getting my doctor's appointments set up. And something that's really important is to also get your hearing checked. And so, like I said, we've been living a quieter lifestyle. We've been wearing masks. We're losing some of those social cues perhaps, and so it's important that as we're just re-engaging with the world, we're just really figuring out how to best listen to others. Obviously communication and listening go hand in hand, and so we're really trying to push for everyone to have their hearing checked, because you just want to make sure that when you're out there in the world you can hear the best. When you have a mask on, who knows how long we'll have masks for, but it does seem like they're going to stick around for the near future. When you have a mask on, you lose those visual cues. You aren't able to lip read or speech read, and when you don't have that opportunity, you realize how much that can impede your conversation. And so, as we're re-engaging with the world, we just want to make sure that our ears are hearing the best and they're doing the best that they can. And so one way that you could easily do that is we do have free hearing screenings here at Hearts for Hearing. It's just a really quick way. It just takes a few minutes for you to have your hearing checked to see if maybe you potentially need a more comprehensive evaluation. And so if you're interested in having your hearing screened, just making sure that your ears are healthy, feel free to schedule that with our front office. You can also find our contact information on this Facebook page as well. But feel free to give us a call. Again, it just takes a few minutes, and it's a great way to see if your hearing is what you think it is. And so, why is hearing important? Why do we need to check our hearing? Well, they say that your ear is a gateway to a lot of the other bodily systems that you have. And so, if you're having issues with hearing, most likely that could be related to something else that's happening in the body. There's a lot of connection between hearing loss and cardiovascular disease, kidney disease, thyroid issues. And when we encounter some of those issues, if you are a patient that has diabetes, or you have a patient that is struggling with kidney issues, then you definitely want to get your hearing checked too. But one of the big things that we really push is the connection between hearing loss and dementia or cognitive decline. A lot of the times when your ears are not receiving the input because of some sort of hearing loss, that means your brain is not receiving that input as well. And when you have that issue, those neural pathways start to die down, and then that's where you get that higher chance of dementia or Alzheimer's. And so, one thing that we really talk about in almost every appointment that we have with patients is you want to make sure that your ears are healthy, just so your brain is healthy as well. So if you feel like, you want more information about that, please feel free to ask a question. Please feel free to come and talk to us about it. But we really feel like the ear is connected to the body in so many different ways. I know a question that we get asked often is, why do we tout Hearts for Hearing is the best? I'm biased, obviously, but why should a patient choose to come here? Oklahoma City is really important as far as the hearing care world here. There are a lot of great hearing aid practices here locally, but why Hearts for Hearing? Why are we different? And so I'm just going to talk through some of those things. If you have any questions regarding that, please feel free to put it in the chat. But really, so I don't know if you guys are aware, so Hearts for Hearing is a nonprofit organization. So the adult side, we started about 9 years ago, 8 or 9 years ago, were the proceeds and profits from our side. So we just work with hearing devices. The proceeds and profits from that go towards the nonprofit, which are the kiddos. So we provide the first set of hearing technology for children under the age of 11. And we want to make sure that patients from newborn all the way till the elderly are well taken care of as far as their hearing goes. And so if you come here to Hearts for Hearing, you choose to purchase hearing devices through us, then know that the extra funds from that will go towards a great mission. Secondly, we just want to make sure that we are a center of excellence for all things hearing related, and not even hearing related, ear related too. And so what that means is we're going to take care of your hearing. We're going to take care of your balance. If you have any dizziness issues, the part of the ear, there's the hearing part, but there's also the dizziness and balance part too. And so we just opened a new vestibular clinic recently. And so again, anything ear related, we want to help with that. There's also a sound sensitivity program or a tinnitus program. So I think tinnitus or ringing of the ears, chirping, any sound that's happening that is not caused by an external sound. A lot of the times that can be quite bothersome to patients. And so we have a program that helps manage that. So if you are experiencing anything with hearing, anything with balance, or anything with tinnitus or sound sensitivity, we want to be there to help you. And I always talk about how an adult patient, or kid too, a pediatric patient, they can come here and be treated for any type of hearing loss. So if you have near normal, you're just having a little bit of issue, all the way to profoundly deaf, we have options for anywhere in between, but also those options as well. So if you are really thinking you might have some sort of difficulty, we would love to see you. Thirdly, I think that we provide what we call gold standard care, meaning we go the extra mile for patients. And so the adult clinic is very unique in this fact that we spend a lot of time with our patients. The initial appointment that we have with patients is about 90 minutes long, which is really long compared to some of the other practices. And why we're doing that is because we want to ensure that our patients who come here, first of all, we want to make sure that we understand what their listening lifestyle needs. Is this an active patient that's still working, that is in a lot of group meetings? Is this a patient that's really social, that needs something with maybe more hearing aid processing to help in background noise? Is this a patient that's living a quieter lifestyle? Is this person needing something, but maybe they have cognitive issues, or maybe they have dexterity issues? We just really want to dive into that personal patient and just see what that patient needs. And then also we do a very comprehensive hearing evaluation. So, we want to see how well you do as far as word understanding goes, how well you're doing in background noise, and we want to put all of that together along with what you've talked about as far as your hearing needs, and then that comes together to decide and select what kind of hearing technology you're needing. And so we work with all of the 6 major manufacturers of hearing devices. You don't need to know all of them in depth because that's where we come in. That's where we're helping guide what you need. But we really try to look at the patient as a whole person. And I like to say hearing is personal. So with eyeglasses, you put on glasses and most likely you're good to go. Hearing is not quite like that. There are many computers on your ears, and that requires a lot of fine tuning and just seeing what's comfortable for you as the person. And so if hearing, one type of hearing loss for a patient is not going to look the same for another patient. And that perception of hearing is different between those two. And so we really try to personalize that experience for that specific patient. And so a lot of time is spent in figuring out what's best for the patient, and a lot of time is spent fitting and programming hearing technology for that patient. And so we really like to use what we call real ear probe microphone measurements. What that means is there's a computer in all of our offices that have little microphones. And these little microphones go inside the ear canal, and it is measuring the sound that is coming out of the hearing device. And we measure and we program that hearing device according to research-backed algorithms that have been proven to improve speech clarity. So if we meet these little targets on the screen, then you have a better chance of being able to understand speech. And a lot of practices in the nation even don't take the time to do it. And so that's something that we really like to base our fitting and our programming algorithms on, just because we know that it's going to work for our patients. We also make sure that, if there's a specific piece of technology that you need, that we provide that for you. And so we just take the time to really personalize what you need as a patient, but we also try to use research-backed protocols as well. Another thing that I think makes Hearts for Hearing special is that we have, again, these awesome extra clinics in place, and I think we'll have some future sessions with those providers. So again, our vestibular and balance clinic, we're going to have Dr. Amy Labier on here soon, and she'll be talking more in depth about what we provide for those patients who are struggling with dizziness and balance issues. And then Dr. Kristen Barton, she'll be joining us to talk about tinnitus and sound sensitivity and how we can help patients who are struggling with that. So I'm just going to see if we have any questions here. Doesn't look like we do. Okay, all right, so looks like we have a question here. Is there a best brand of hearing aid? Thank you, Annie, for asking that question. So again, we work with all the major manufacturers of hearing technology. And is there a best one? I get asked that question a lot by my patients. Well, what would you say is the best one? And it's really not what I think, it's really what the patient thinks and what the patient needs. And so like I said, we really try to personalize what the patient requires, and then as we're looking at all the different major manufacturers, we see what we think is going to fit best. And I think right now with hearing technology, you hear a lot about online hearing aids or hearing aids that are over the counter. That's awesome in the sense that patients can have direct and easy access to hearing technology. But like I said, hearing devices are small computers on your ears, and you really need someone to help personalize that to the patient. And so if you don't have someone helping you, if you do purchase a hearing device over the counter, then you lose that personal touch, but you also lose that expertise as well. And so is there a best brand of hearing aid? I would say it's really just going to be dependent on what you personally need as the patient. Looks like there's another question. How do you know if I need a hearing aid or a cochlear implant? And so you can access our chief of audiology, Dr. Wolf, he actually did a Facebook Live over cochlear implants, and so you can access that on our YouTube page. But how do you know? So again, that's going to be something that an audiologist is really going to help guide you through. So we're going to be looking at how well you've been doing with hearing technology if you already use it, how well your word understanding looks in both quiet environments and environments with background noise. You're also going to be able to have some really extensive testing as far as if the hearing devices are fit perfectly, or what we call the best aided condition, how well are you going to be able to do with those? And so we just really look at you as the person, but then we also look at your hearing, and we also look at you medically as well. So we work with a lot of local ear, nose, and throat physicians that are awesome, that are going to be looking at you as a medical candidate and see how well you can do in a surgical procedure. And then once you go through the process of getting implanted with a cochlear implant, if it does seem like you're a candidate, then the audiologist will come in, and it's a collaborative approach in how we program the cochlear implant. So I think that's a great question. Looks like there's another question here. So as an adult, is there an age that is too early to get my hearing checked? Absolutely not. I think that the hearing mechanisms in your ear are really sensitive. And so even if you feel like there might be an opportunity or might be a chance where you're having trouble hearing, then I think it's a great sign for you to come in and get your hearing checked. Like I said, the free hearing screenings just take a few minutes, and it points to maybe a bigger issue that might be happening. And so if you have any doubts at all, especially as we're re-engaging in environments with background noise or people wearing masks, I think it's a great idea to have your hearing checked. But no, it's never too early to get it checked. Let's see, Troyce asked, what do hearing aids look like today in terms of capabilities? Troyce, that's a great question. Hearing devices now, technology is always improving, and hearing technology is the same in the sense that there are always new innovations happening. One thing that the hearing industry is trying to always improve on is how well people can hear in background noise. And so, obviously that's a big issue for others. You want to be able to step into a restaurant and hear the conversation around you, but not necessarily the waiter, cleaning up dishes over here, or a conversation that's happening outside of your table. And so a lot of the things that the hearing industry is working on is how to best make those filters, or the noise reduction filters, better. And so a lot of improvements have happened over the past year to 2 years as far as noise reduction goes. Obviously Bluetooth is a big issue, so we've got a lot of AirPods happening, or headphones that work with Bluetooth. Well, hearing devices can also work like Bluetooth devices as well. And so the capabilities of streaming from your phone, your laptop, anything Bluetooth related, it can actually stream to the hearing devices directly. So you don't need those AirPods, and you don't need those Bose headphones anymore. You can actually use your hearing devices themselves. And the great thing is they're actually going to account for your hearing. So if you have a high-pitched hearing loss, those AirPods may not be accounting for that, whereas your hearing devices can. And so, like I said, it's very personalized to you in your hearing, but the Bluetooth options have been awesome. Thirdly, a big thing is rechargeability. So no more batteries, no more having to purchase batteries or change them. This is really important for patients who have maybe vision issues or dexterity issues. Instead of having to change those small little M&M sized batteries, you can actually put the device just directly on the charger. So you don't have to worry about doing that anymore. You don't have to worry about carrying an extra package of batteries. Just like you're charging everything else in your house, you're going to use the same type of lithium ion technology in the devices as well. So we have a question from Kristen. What's the harm in waiting to get hearing aids if I've been told I have hearing loss, but I feel like I do okay without them? That's a great question. So a lot of the times when we talk to patients about hearing loss is a gradual issue. It happens slowly over time for the most part. And because of that, your brain gets used to not being able to hear well. And you really don't notice that you're not hearing well until you can hear again. So you may not notice that you're not listening or you're not hearing the clicker in your car when you're turning, or you don't notice that your granddaughter's talking in the back seat, until she's yelling at you. And so really, you don't notice that you're missing out until you get that restored again. And so because of that slow process, it's really difficult for patients sometimes to acclimate to hearing devices instantly. So when we have a patient come in, we're fitting hearing technology, we're not going to put them at 100% of their prescription because it's just too much for them. They've gotten used to a way of hearing, and we can't restore it like that overnight. And so because of that, we try to bring down that prescription, make it comfortable for the patient, and then we start that acclimatization process for them. Sometimes, though, when you wait too long, we get into a situation called auditory deprivation. So those nerves, those neural activities that usually happen when you're hearing well, they're, again, gradually dying down. And it gets to a point where if you try to fix those neural pathways that aren't working quite as well, you'll get to a point where it's just not possible. You'll get to a point where the hearing technology is not going to be able to provide enough activity for those neural pathways to regenerate. And so we understand that patients have to wait. Things come up, budgets come up, we understand that. But for your brain to be as healthy as possible, we want to treat the hearing loss as quickly as possible. So we know that there are situations where you have to wait, but really for you to benefit from hearing technology, you want to go as quickly as possible as far as treating. But that's a great question. How can I protect my hearing is one of the other questions we got here. So obviously, hearing protection, I get made fun of by my friends all the time because I carry around my personal earplugs with me, and I wear them in my workout classes, and any concert that we go to, I always have them in. But just any kind of hearing protection is going to be best. Even those little foam earplugs that you see in Walgreens or the pharmacy, those are going to be best. Well, they're going to be good, but they're not going to be the best. But they're going to be good and better than anything else. And so we offer different types of hearing protection here. So you have the non-electronic kind. So just like the foam earplugs, they're what we call passive. There's nothing that's helping you to reduce the noise electronically. It's just a passive earplug basically in the ear. But then there are also what we call electronic hearing protection as well. So that's going to be having a filter, an active filter. So when a noise comes, then the filter is going to dampen that down quickly. And so we offer all of those different options as far as hearing protection goes here at Hearts for Hearing. This is going to be really important for those that are hunting or using firearms, those that are working in environments with machinery or equipment. But that's also going to be important for those that are using lawn equipment or mowing their lawn or going to concerts. Our minds and our ears are always around loud sounds. We want to protect them as much as possible, and we have different options here that we can talk through. All right, so we have a question here from ZB. My grandpa has very bad hearing. He refuses to get tested. How should I direct this conversation to get him to go to an appointment? That's awesome. That's a great question, and we run into this situation quite often with our patients. But I would say, really just talking about how the hearing is affecting you and just how that affects his relationships with others. Like I said, communication and hearing go hand in hand, obviously. And so a lot of the times when you can have that conversation honestly about how it's affecting your relationship with that person, then a lot of the times that will motivate someone to come in. A a lot of the times we just say, come on in and we'll do most of the work. So if you can convince them just to even come and do a quick hearing screening, then we can do a lot of the legwork to get that patient in for a more comprehensive evaluation. But because hearing loss is just so gradual and such a issue that doesn't really come out until, like I said, your hearing is better, it's sometimes difficult to have those conversations. So I really feel for those that are needing to help motivate their family members to come in. But like I said, if they realize how much of an effect their hearing is having on you, then a lot of the times that will help the patients or potential patients come in and motivate them here. So one last question here. So what does an appointment look like? So like I said, with our new patient appointments, a lot of it is going to be talking and just figuring out what the patient needs. So we're going to be talking about, how well can you hear the television? How well can you hear on your telephone? How well do you feel like you can hear in background noise? What does your hearing history look like and your ear history look like? We're going to be diving into a lot of those questions just to see what you as the patient needs. And we're going to ask you specific situations where you feel like you might want to hear better in. Secondly, we're going to do a hearing evaluation. So like I said, that's going to be looking very in depth at your hearing, at how well your middle ear's working, how well your inner ear's working, how well you're doing with speech sounds, how well you're doing in background noise. So we try to make the hearing evaluation as comprehensive as possible. And then lastly, we're going to really dive into what the results mean and what that means for you as far as what you need for your hearing technology, and also take into account what you've talked about as far as your hearing lifestyle and what your lifestyle needs. So that's going to be your new patient evaluation. We're also going to help you select some hearing technology if it seems like you're a candidate. And we love to go into detail about all the different manufacturers because we want to make sure that what we select for you is correct and that it's something that you're comfortable with. For our hearing device fittings, we're going to do some measurements. Like I said, those real ear probe microphone measurements. We're going to take those to make sure that your hearing technology is appropriately fit, but we're also going to make sure it's comfortable for you. So like I said, we're not going to start off at 100% of your prescription. We're going to bump it down until you think it's comfortable, and then that's going to be our starting point in getting you to where you're going to be hearing your best. We're going to explain how the technology works and how to take care of it. A lot of the things that we talk about, we're going to address in future appointments too, just because it is a lot of information that we throw at you, and we want to make sure that you're comfortable with that information. So it's a lot of repetition, and we will, hold your hand through the whole experience of hearing technology, because like I said, it's personal to you. Every patient is different, and so we want to make sure that you're comfortable with that individualized plan of care. And then after that, it's just making sure that you're comfortable with the devices, that you're not in a certain situation where you feel like you could have heard better. If you do think that, then we ask you to come back in so we can make further changes and make sure that the technology is working for you. And so that's really a lot of what the hearing journey looks like. It's a lot of just personalization, a lot of listening, and just trying to figure out what's best for that patient. So, all right. Well, I really just want to say thank you guys for engaging with me. We've had some really great questions. If you forgot to add a question or you think of something later, please feel free to put that on our Facebook page or any of our social media pages, and we will make sure that we get the answers to you directly. But like I said, thank you guys so much for your time. It's really a privilege to be able to engage with you all, and I hope you guys have a great day. So thank you so much.